Good evening, everyone, and welcome to the 2082nd uninterrupted webinar series of the International Forum for Promoting Homeopathy. I am Arya. I'm a third-year student from Adurashramam NSS Homeopathic Medical College, Kottayam, and I'll be your moderator today. So today, we're going to deal with a very important lifestyle problem, which was once considered a disease of the elderly. Diabetes mellitus has now silently entered classrooms, colleges, offices, and even maternity wards, becoming one of the greatest metabolic epidemics of the modern era. Sedentary lifestyles, unhealthy dietary habits, stress, obesity, as well as genetic predisposition has contributed to this alarming rise of diabetes among younger generations also. Today, millions worldwide are affected not only by type 1 and type 2 diabetes, but also by conditions such as gestational diabetes and other metabolic disorders. So it is just more than, diabetes is more than just high blood sugar. It is a chronic metabolic disorder, as we all know. So this seminar explores the growing burden of diabetes, its diagnosis and contemporary management with homeopathy as addressing the patient as a whole. So today our guest is Dr.Asha Varghese. She is the chief physician at Ambadi Homeopathic Clinic, Bangalore, and she's also the current president of the IHMA Bangalore chapter. And she has more than 25 years of experience. And today she'll be talking to us on the topic control of diabetes mellitus with homeopathic medicines and diet and regimen. We welcome you, ma'am. The dice is all yours.
Thank you, Arya. Am I visible, Arya?
Please, yes, ma'am.
Please adjust your camera a little more. We can.
Yeah, is it clear, sir?
Okay, yes.
Fine.
Yeah, and Arya, there's a correction again. I was the president of IHMA. Now I'm the vice president, Karnataka.
Okay, ma'am. The data given to me was like that. So I'm directly reading
group,
from
Iconic
there.
Women. You were revised one. Yeah, thank you so much. And Danish, sir, today's topic is, diabetes. And good evening, everybody. Shall I start with that? And with a silent prayer to all my elders and Dr. Hanneman. I'll just share screen, sir.
Yeah, ma'am.
So this particular topic, frankly, I had around more than 80-90 slides. So that would be like, difficult to finish off probably in a day. So I thought I'll just take it as 2 sessions. And the first one would be with the case I will be starting. And eventually I'll be going for the rest of the, diabetes in detail. Okay, so the case I will start and I'll, we'll finish off the first session and then I'll go into the diabetes, the causes, etc. So this is a 49-year-old male. His HbA1c was 9.4. Mean blood glucose was 223. Total cholesterol 207. Triglycerides were 461. So why I took this as the first part is everybody knows about per se diabetes, and that's like a very common topic and everybody has been seeing it on a regular basis. So let us start with this. So after, since the sugar was so high, like hemoglobin was so high, the HbA1c was so high and triglycerides were so high, naturally, we had to look at the pancreatic. Amylase was 198, lipase was 171. So we'll get into detail regarding this first, and then we will go further with the diabetic. So after medication, this was in the month of July. And after medication, the HbA1c dropped down to 6.1. The amylase came down to 141. That is in January. We checked again. The triglycerides was 174, 73. And amylase had come down to 141. And lipase was 88.1. So we'll just finish with this case and then I'll explain to you what was given. Okay, the medications. What are amylase and lipase? Amylase is a digestive enzyme. It is produced by the pancreas and salivary glands. Its function is to digest the carbohydrates or the starch into simple sugars. Lipase, on the other hand, it is mainly produced by pancreas. It is digest the pancreatic health. So glucagon. And exocrine function is produced. It produces digestive enzymes like amylase and lipase. In diabetes, become
I came today after a long journey from Rameshwaram, Tanjavur, Kumbakonam, and since 6 days I was roaming. I am so tired. That's why I didn't put
Okay.
the video. Anyhow, see, for diabetes, the doctor G. Harikumar, he used to tell every week lycopodium 10 2 doses should be given.
Okay.
Every 10 every week, followed by indicated medicine, constitution medicine, as well as the mother tongue. They have to see what is clear. Let her tell.
Okay. Okay. Our guest has joined.
Okay, okay.
Okay. Okay, doctor, you can go ahead. Asha Varghese?
me. Yeah. Okay. Am I audible, sir?
Fine. Everything is fine. We can see
Yeah,
the.
yeah, fine. Okay. Yeah. So the amylase and lipase was 198 and lipase was 171. And in November, it came down to 6.1, the HbA1c. And amylase had come down to 141, lipase 88.1, triglycerides had come down to 173. I think I had my mother for the rescue, I believe. She was taking it up for me during that gap. Thank you so much, Mama. So we will go in detail regarding, what is amylase and lipase. Amylase is a digestive enzyme. It is produced by the pancreas and the salivary glands. Its function is to digest carbohydrates into simple sugars, while lipase is produced mainly by the pancreas and its function is to digest fats into fatty acids and glycerol. Both enzymes are important indicators of the pancreatic health. So what is the relationship between diabetes and the pancreas? Pancreas has two major functions. The endocrinal function is to produce insulin and glucagon, and the exocrinal function is to produce enzymes like amylase and lipase. In diabetes, especially the long-standing and the uncontrolled diabetes, pancreatic functions may become affected. So amylase and lipase level in diabetes, normal diabetic mellitus, in uncomplicated cases, amylase and lipase will be normal. Mild variations might occur. But in acute pancreatitis with diabetes, sometimes diabetes is associated with pancreatitis, and in acute pancreatitis, serum amylase will be elevated and serum lipase also is markedly elevated. Blood sugar also rises due to pancreatic inflammation. Symptoms: severe upper abdominal pain, pain radiating to the back. Sometimes you'll have vomiting, fever, abdominal tenderness, and lipase is considered more specific for pancreatic disease. So we have to know what is diabetic ketoacidosis, DKA. In DKA, amylase rises, lipase also rises, but there will be no pancreatitis. There may or may not be. This occurs due to metabolic stress, dehydration, cellular injury, and therefore elevated enzymes in DKA should be interpreted carefully. Chronic diabetes and pancreatic exhaustion. Long-standing diabetes may cause pancreatic fibrosis, reduced enzyme secretion, exocrine pancreatic insufficiency. So because of this, amylase may become low, lipase might become low, the patient might start getting indigestion, bloating, fat malabsorption, weight loss, etc. So why is lipase more important than amylase in diabetic, especially in these cases? See, amylase is produced by pancreas and many other organs like salivary glands, ovaries, and all the stuff, while lipase is mainly produced by pancreas. Specificity, this is more specific. The lipase is more specific. Rise in pancreatitis, it can be detected. Early rise, it will be amylase will rise, and then gradually lipase within 3 to 5 days, while the elevated lipase of level of lipase will continue until 14 days. So you can understand in this, amylase it increases in many non-pancreatic conditions also, like salivary gland infections, kidney disease, intestinal obstruction, ectopic pregnancies, alcoholism, etc. While lipase is predominantly produced by the pancreas. So it shows pancreatic involvement. Am I clear? Am I audible, sir?
Yes, clear.
Okay. Lipase remains elevated longer. So amylase, as I said, it increases within 6 to 12 hours and it normalizes quickly, while lipase increases within 4 to 8 hours and stays elevated for up to 2 weeks. Therefore, lipase is more useful when the patient presents late. Higher sensitivity in pancreatitis. Lipase, it detects acute pancreatitis, alcoholic pancreatitis, hypertriglyceridemia, like related to pancreatitis. Can you hear me now?
Yes, very well.
So what are the conditions which causes amylase without pancreatitis to increase? Mumps, salivary gland diseases, intestinal obstruction, and macroamylasemia, that is a benign condition in which amylase binds to large proteins which cannot pass through the kidney glomerulus. So it is not a true pancreatic disease, but it is a autoimmune problem. It is. So for the reference, so lipase means only the pancreas are affected. Amylase means many organs are affected. So what is the range of normal range of amylase? That is 30 to 100 units per liter. And lipase, it is 0 to 160 units per liter. So what are the investigations we generally do for the diabetic? Serum amylase, lipase, fasting blood sugar, HbA1c, ultrasonography of the abdomen, CT, pancreas. Clinical importance in diabetes. Increased amylase and lipase in diabetic patients indicates acute pancreatitis, DKA, ketoacidosis, diabetic ketoacidosis. So DKA, you have Kussmaul's breathing is there. Then you have acetone kind of smell from the mouth. All the rest of it, like, the scan also shows the demarcation between the cortex and the middle. I mean, this one of the kidney CT scan has to be done. Gallstone pancreatitis, alcohol-related pancreatic disease, and drug-induced pancreatitis. Other important cause of pancreatitis in diabetes is gallstone disease, chronic alcoholism, hypertriglyceridemia. So that is what here it is. This person had very high triglycerides. And some diabetic medicines rarely cause pancreatitis. So first we look at the case again. This patient was given Cesium jambolinum as a medication to decrease his that is my medicine of choice, Cesium jam Q, and pancreatin was given in high potency for a better result, and insulin was given in lower potencies as intercurrent. Okay, so we can see that you can see that the sugar level has reduced from 9.4 to 6.1 in the later on slides. And the triglyceride also has come down from 461 to 173. Lipase has come down from 171 to 88.1. amylase also has reduced considerably. 198 it has come down to 141. So now we look at the dynamics of diabetes. Why does it happen generally? See, the thing is, whenever the pancreas, I'll talk about the diet now. So whenever the patient has diabetes and he has triglycerides, for diabetes, generally what we do is we ask them to take a low sugar diet. Okay. So, but low sugar diet and all the carbs, etc., if you add fat into it, the sugar absorption becomes less. So therefore, people tend to eat some kind of a fatty food, or they put little bit of ghee or oil to reduce the absorption of fat into the food, into the body. But what happens in these cases are, you have to monitor the food in such a way that the fat is also controlled and also your diabetic levels also controlled. So you have to cut down on fat and the carbohydrates. And you have to increase fiber into the patient's diet. Now, fiber, what happens with fiber is, I have seen lots of patients who come down with, we eat lots of fibers, but still we are bloated and there is constipation, etc. So whenever you eat fiber, you should understand one thing, that will be like a sponge. It is full of fiber. Okay. So all the vegetables, etc., is full of fiber, fiber like a sponge. And when sponge is very dry, that is the condition in your abdomen. So people who are on high fiber diet, mandatorily, they have to ensure that they're having large intake of water. Otherwise, they'll have bloatedness, they will have flatulence, and they'll have severe constipation. So it isn't like you have fiber and therefore your diet is going to be, your bowels are going to be good. No, along with fiber, it is a mandate to have ample amount of water. Now we'll look at the psychodynamics of diabetes mellitus. This patient was given acid force as a constitutional remedy. Okay. So why acid force? Because this patient was, he had severe IT professional, lots of workload. And second thing was, he was constantly complaining of weakness and tiredness. That's the first thing he used to tell me, I'm very tired, very weak. And of course, everybody has their share of stress in Bangalore. So, being in the IT fields, etc. So what are the psychodynamics of diabetes mellitus? Every disease will have a psychodynamic. Here, the psychodynamic of diabetes, it refers to the emotional, psychological, behavioral, and unconscious factors that influence the development, aggravation, coping, and management of diabetes. See, it does not mean that emotions alone cause diabetes, but psychological conflicts, stress patterns, personality traits, and emotional suppression strongly influences the blood sugar regulation, eating behavior, hormonal balance, and compliance with treatment, and the disease progression also. So if you look at the dynamics of diabetes, you can practically have 10 to 20 slides on it. So I can't go so much into detail. We will concise into a few points. Suppressed emotions, any kind, either like, not getting enough attention, enough love, sadness, any suppressed emotions, which is half of the personalities we are working with. Silent grief, typically an atrium kind of anxiety. Most, very commonly we are seeing GAD nowadays. Fear of the future, which is with 90% of the cases. Emotional deprivation, either they're not getting enough attention, enough love, all those. Lack of affection, persistent worries. Lack of affection is seen amongst children today because of both the parents working, etc. Am I audible?
Yes, ma'am.
Yes.
Okay. Burnout, depression, and after that you have burnout. Okay. Burnout is you are working for a very long number of hours and you are exhausted. In which case, sometimes you can give acid force. In this case, fear of failure, again, a major thing happening in today's world. hidden insecurities with the present world scenarios, emotional isolation, chronic tensions, poor coping ability. So if you look at it, though it is a few points, practically 99% of the people are falling into any one of this category. Okay, so I'll just in homeopathy, few medicines you can think of as constitutional. Silent grief, ignatia, emotional contradiction, suppressed disappointment, etc. Natramur, reserved emotions, dwells on the past, craves solitude. Staphysagria, suppressed anger, humiliation, silent suffering. Lycopodium, lack of confidence, hidden by authorities, fear of failure, digestive disturbances. Phosphoric acid, diabetes after grief, exhaustion, etc. And mental burnout, debility. Now we'll look at the diabetes mellitus part of it. It is a chronic metabolic disorder. It is characterized by high blood level, hyperglycemia resulting from deficiency of insulin secretion, resistance of insulin action, or both. So insulin is a hormone which is produced by the beta cells of the pancreas, which helps glucose enter the cells to produce energy. When insulin is absent or ineffective, glucose remains in the blood, causing elevated blood sugar levels and long-term damage to organs. So this is the islets of Langerhans. These are the beta cells, and these are the destroyed beta cells. You can look at the picture. So I have told you earlier, pancreas has it secretes digestive enzymes, and it also secretes hormones like insulin, glucagon, somatostatin. So insulin, it functions, lowers the blood glucose, promotes glucose uptake into muscles and fat, stimulates glycogen formation. It prevents fat and protein breakdown. Normal glucose metabolism, after we eat food, carbohydrates, it gets converted to glucose, it gets into the blood. Pancreas releases the insulin. Insulin transports glucose into the cells. Blood sugar, it returns to normal eventually. In diabetic, insulin is absent or ineffective and glucose accumulates in blood. Cells remain energy deficient. See, what happens is, if you have any kind of carbohydrates like glucose drinks, etc., the spike will be very high and the dip will come down very low. In the sense, you start feeling hungry after a particular time. This pattern has been seen in diabetics. So what they generally do it, if you do not have triglycerides, consumption of fat along with the carbohydrates will reduce the absorption of glucose fast. So you will have a small spike. It will remain for a long time and you will not have the sudden dip by which you will feel hungry. So there are two types of diabetes. Diabetes 1, type 1 diabetes, an autoimmune disease causing destruction of pancreatic beta cells, leading to absolute insulin deficiency, occurs in children and young adults, sudden onset, thin body type, requires insulin therapy, autoimmune destruction, genetic predisposition, and viral triggers. Symptoms typically polyuria, polydipsia, polyphagia, weight loss, fatigue, complications, ketoacidosis. Type 2, characterized by insulin resistance with relative insulin deficiency. Most common, seen in adults, especially in the younger ages, associated with obesity and sedentary lifestyle. See, this is where we have very good scope. Okay, so you have a family history, there is obesity, hypertension, PCOS, sedentary lifestyle, stress, and unhealthy diet. So, frankly, family history, a little difficult probably, but obesity, it can be cut down. So, first and foremost is obesity does not occur in a day and it is not going to go away in a day. So, putting the patient on a crash diet, etc., might not help. So, ask them to increase the fiber intake, say about half the plate of his food should be salads, and protein, say 1/3 of his, 1/4 of his plate, and carbs, and whatever the rest of the protein, carbs, carbohydrates, and salads. Okay, so this is how the half of the plate should be salads. Then hypertension. So like I said, triglycerides and, hypertension or the whole lot of diabetic, etc. together, kindly check the pancreatic health, that is lipase and amylase. PCOS, again, we know that we have to check insulin for, HbA1c is mandate for PCOS because of the typical, I don't have to go into detail into PCOS, we all know it. Sedentary lifestyle, again, ask the patient to go for a walk morning and evening possibly, and a mandate walk after food. Okay, that seems to be again bringing down the diabetic levels. Stress. See, stress is something which generally happens because of insecurities nowadays. Counseling is mandate. Unhealthy diet, again, no oily food. Cut down on oil. As such, I think we have a prime minister who has been telling us to cut down on oil consumption because it is an import, material. So I think very minimal oil. So I keep telling my patients, no seasoning or tempering food. So cut down on tempering and try to use minimal oil as possible. Little bit of fat is needed, but you can reduce it. Pathophysiology, insulin resistant develops, pancreas produces more insulin, beta cells become exhausted, blood glucose increases. Again, the symptoms, increased urination, increased thirst, tiredness, infections recurrently, delayed wound healing, and blurred vision. So polyuria together, polyuria, polydipsia for polyphagia, increased, frequent urination, increased thirst, increased appetite, weight loss, weakness, fatigue. Other symptoms are blurred vision, delayed wound healing, itching, etc. of skin, genitals. So whenever some people, some people, they are not aware of the diabetes, but they come with pruritus. So we have to look at the 3 months average or the HbA1c. Or you can ask them to go for the random blood sugar, whichever is necessary. Recurrent infections, burning in the feet. So this is another thing, neuritis of feet, numbness, dry mouth, leg cramps. Pathophysiology, carbohydrates gets converted into glucose. Insulin helps glucose enter cells. Glucose remains in blood. Cells become energy deficient. Fat metabolism increase. Protein breakdown occurs. It causes hyperglycemia, glycosuria, ketosis, and vascular damage. What are the chronic complications of diabetes? This is very important for us to know. Retinopathy, nephropathy, neuropathy, macrovascular, coronary artery diseases, stroke, peripheral vascular diseases. See, we might not, I'm sure all of us know, but looking at the heart health is very important for during diabetes. Diabetic foot, recurrent infections, erectile dysfunction. So in detail, we'll see later. So this is gestational diabetes. Who is at risk? If it is body mass index is more than 30, they had a baby who weighed very heavy baby, more, those mothers are at risk. Gestational diabetes in the previous pregnancy. One of your parents or siblings has diabetes, that is a family history. Your family origins are South Asian, Chinese, African. This is more like the origin, certain diseases attributed to certain places. So what are the symptoms? Again, increased thirst, frequent urination, tiredness, and dry mouth. When body does not make enough insulin during pregnancy, temporary condition pregnancy, increases risk of complications during pregnancy and delivery, and increases risk of type 2 diabetes for mother and child. It is diagnosed through prenatal screening rather than reported symptoms. Definition of gestational diabetes. Diabetes is diagnosed during pregnancy. Pregnancy hormones create insulin resistance. This is the reason many, many of the mothers have gestational diabetes. Risk large baby, difficult labor, further type 2 diabetic in mother. Secondary diabetes, it occurs due to pancreatitis. So sometimes diabetic might be the aftermath of some other disease. So it is pancreatitis. Steroid therapy, endocrine disorders, pancreatic surgery, Cushing syndrome. So again, this is all explained in. So you have two. One is hypoglycemia, when it suddenly goes down. What happens? As I said, the spike will go down in many cases. When you have too much sugar, it will spike up and there will be a spike downwards also. So in that case, there will be hypoglycemia, hunger, irritability, pallor, sweating, lack of coordination, and sleepiness. See, you must have seen suddenly people fall off like because of hypoglycemia. Hyperglycemia, we all know the symptoms: thirst, fatigue, frequent urination, blurred vision, headache, dry mouth, etc. So fasting blood sugar, normal, it should be less than 100. Pre-diabetic, 100 to 125. Diabetic is more than 126. Postprandial, more than 200. HbA1c, equivalent to or less than 6.5. It reflects the average blood glucose over 3 months. Random blood sugar, more than 200 per deciliter, with symptoms such as diabetes. So acute complications, one is diabetic ketoacidosis, DKA. What are the features? There will be vomiting, abdominal pain, dehydration, a fruity breath of the odor. See, there was one of my case in which the child has DKA and the child did not show anything. Even the scan did not, get anything. But he had a very typical breath, which was like a acetone kind of breath. The acetone, what we put the nail polish and the nail polish remover breath it was. So we had, it was coming very frequently. Then he was referred, and after that we came to know that he had DKA. It was a very new case. So, but then he had to go for a kidney replacement from his mother. His mother was the donor. So that was a case which was long back. This case had happened. So this breath is something you have to keep checking. Deep breathing, Kussmaul's breathing. That is, they are trying to compensate for the carbon dioxide should reduce and the pH should reduce. So that is another. Ketoacidosis is another, long lecture. Hyperosmolar hyperglycemic state, that is usually seen in type 2 diabetes. Severe hyperglycemia, dehydration, and again, altered consciousness. So what is the management of diabetes? Lifestyle modification, reduce refined sugars. Yeah. So if you use the natural fruits as sweetening agents, this does not seem to be causing so much trouble as much as the refined sugars. So in comparison, probably jaggery is better, but jaggery is not an alternative thing. It's not like you eat jaggery and you will not get sugar. No. Increase the fiber, balanced meals, and portion control. Like I told earlier, a person is used to a particular quantity of food. So what I generally ask him is, I don't ask them to suddenly cut off all the portions. I ask them to finish the salads first, then the protein, and then go for carbs. So salad should be, as I said, half of the plate, and especially spinach and green leafy vegetables has lowest glycemic index. So you have to look at the glycemic index of food, and which has the highest glycemic index and which has the lowest glycemic index, etc. And then therefore the meal should be balanced. So initially, if the person is taking 4 rotis and you can only cut down to 3, 2, 1, that is a very eventual process. Like it cannot be done from, okay, you're diabetic, from tomorrow you're not going to eat, you're going to eat only 1. The person will be very exhausted and tired. Increases fiber and gradually reduces carbohydrates. Portion control is over. 30 to 45 minutes of daily exercises improves insulin sensitivity. Very important in type 2 diabetes is the weight reduction. Investigations. One is the fasting blood sugar. This is the most common screening we do. Indicates the baseline glucose regulation. More than 100, is, less than 100 is a normal fasting blood sugar. It is more than 126, they are diabetic. Postprandial, after food, more than 200, it is 150, but more than 200, they are diabetic. So it is a blood collected 2 hours after the meal, detects post-meal glucose rise, useful in early diabetic cases. Random blood sugar, again, more than 200. Emergency assessment, initial screening. HbA1c, it measures the percentage of glucose attached to hemoglobin. Normal 5.7, pre-diabetic 5.7 to 6.4, diabetic 6.5. In this, no fasting is required, useful for long-term monitoring. It can be altered in anemia, any kind of hemoglobinopathies. In the sense, if you have any kind of blood-related issues, this can be altered. Also in CKD, the HbA1c can be altered. So it is better we look at the hemoglobin of the percentage separately also before doing the HbA1c. Something has got into it. Oral glucose tolerance test, generally done for pregnant ladies also. Gestational diabetes, to see the gestational diabetes. Fasting blood sugar is measured. 75 grams of glucose is given orally, and blood glucose measured after 2 hours. If it is less than 140, it is normal. For 140 to 199, impaired glucose tolerance. More than 200, it is diabetes. Used in borderline diabetic diagnosis and also gestational diabetes. Urine examination, urine sugar, glycosuria. It is again screening, not definitive for diagnosis. Urine ketones are again checked to rule out diabetic ketoacidosis. Starvation, type 1 diabetes. Okay, so even when you are not eating food, etc., during fever, the ketones can increase. Fat breaks down due to insulin deficiency. So I'm just brushing through everything because most of us know all these medications. I'm sorry, all these points. Microalbuminuria, small amounts of albumin urine, early marker for diabetic nephropathy. So that is another thing. These are small signs. Urine examination will not cost us too much. So we can just send them for a urine examination, check if ketones are there, if glucose is present in the urine, and also the amount of albumin, etc. Early marker for diabetic nephropathy, more than 30 milligrams per day. Persistent elevation suggests, in the sense, if they have it, again, recheck it after a couple of days. If it is continuously showing elevated levels, it can be kidney damage. So you have to do or increased cardiovascular risk. So whatever has to be done next has to be done. Renal function test, serum creatinine, blood urea, eGFR. It is all important for assessing the kidney involvement. Lipid profile, total cholesterol, LDL, HDL, triglycerides. Diabetes increases cardiovascular risk. Common findings, high triglycerides, low HDL, and high LDL. So whenever you have diabetes, your cardiovascular risk, in the sense, diabetes is a disease which catches all your organs. So CVS also we can cover up by checking the triglycerides, the high density cholesterol, and the low density cholesterol. And accordingly, we can ask them to do whatever is necessary or support them with medications. Next is liver function test. Fatty liver diseases, monitoring medication effects, elevated ALT, AST levels also has to be monitored. Serum insulin and C-peptide is another thing. So there are many tests. Most of them we do, and some of them we do not do. So serum insulin and C-peptide is not very commonly done. It measures the serum insulin, measures the insulin level. C-peptide, endogenous insulin production is generally seen. Type 1 diabetes, has low C peptide. Type 2 diabetes has high normal or high initially. C peptide, etc. is not generally done, but I'm covering up as many investigations as possible. Autoimmune tests, GAD antibodies, islet cells antibodies, insulin auto antibodies. It helps us to diagnose the type 1 diabetes. So if the person is diabetic and if you feel it is type 1, etc., you can ask them to do all these tests. Again, the arterial blood gases, the CO2 in the pH remains 7.35 to 7.45 it should be. But during diabetic ketoacidosis, the pH will go up and the carbon dioxide will increase. So you have all those bad smell. As I said, the Kussmaul's breathing, all those will happen at this time. So findings. So you have to look at the arterial blood gases also. Then comes we have already discussed it, pancreatic enzymes, amylase, lipase. It is generally seen in pancreatitis. Pancreas damage can lead to secondary diabetes. So see, it can either be that way or this way. It can be it can be elevated because of the diabetes, etc., or it can diabetic symptoms are because of the pancreatic damage. So it can be both ways. Now this is the fundoscopy examination of the eye. So you have this normal retina and there is the diabetic retina. So like you have to check the eye health also. There will be macular edema, diabetic retinopathy will be seen. So therefore eye health, see, diabetes is a disease. It is very prevalent now. It is a disease that will affect each and every part of your organ. This is a diabetic foot. Foot examination has to be done. Sensory testing should be done. Vibration sensing, ulcer examination, peripheral pulses should be examined. It detects whether you have neuropathy, peripheral vascular diseases. And ECG and cardiac evaluation, stroke, heart attack. So chronic complications of diabetes, you should not take diabetes that easily because it can lead to stroke, it can lead to heart diseases, peripheral artery diseases. In today's era, people are so much into every nook and corner. You have ice cream parlors, cakes for every small celebration, etc. So therefore, the risk of all these cardiovascular diseases are increasing day by day. So kindly ensure, that it is our duty as doctors to educate them not to overindulge in all these things. Because nowadays, the cases of cardiovascular diseases has increased, stroke, heart attacks, all this has increased so badly. It could be our lifestyle also. So it is again, we have to know that diabetes has these kind of complications. So diabetics are at a high risk for coronary artery diseases, silent myocardial infarction. See, we hear this word very frequently nowadays. It is a very silent attack. Okay. So the diet, etc., is a very important. Frankly, we are eating more calories than we burn. And therefore, we are adding up and that is leading to all these high risk diseases. This has already been told. So monitoring, every visit, you should check the blood sugar, blood pressure, weight, HbA1c, eye examination yearly once, kidney function has to be checked yearly once, lipid profile, food examination has to be done on a regular basis. So homeopathic approach in diabetes. See, it does not replace emergency insulin therapy in type 1 diabetes or uncontrolled diabetes. So this is something we have to know. We have to know our limitations also. Improving the constitutional balance, reducing symptoms, improving metabolism, controlling complications, enhancing the general health. So this is how, how we approach it. So I'll just cover up a few medicines. First is the Syzygium jambolinum, one of my favorite medications for, diabetes. I use Regweg medications that gives very good results for me personally. It has marked hyperglycemia, excessive thirst, profuse urination, weakness, diabetic ulcers. Clinical features, rapid reduction of sugar in urine and skin eruptions with diabetes and pruritus and old ulcers. So this will decrease sugar in the urine and usually in the lower potencies we can use tinctures 3x and 6C potency, but my favorite is always tincture. Then you have acid force, diabetes from grief, mental exhaustion, debility after stress, nervous weakness, apathy, milky urine can be seen sometimes, sexual weaknesses, tall, thin patients. Phosphorus, nervous diabetic patients. Recently I had a case of GAD with diabetes, and that person has improved very drastically, very well with phosphorus. Very, happy-go-lucky kind of a personality, but he used to get very small thing. The thing he said was, I can deal with lots of things, but when it comes to personal things, I get very nervous, kind of, So, and he was in the argentum nitricum kind. He was a very, the phosphorus kind is what he was. And after taking the case, phosphorus has helped him quite a lot. Great thirst for cold water, weakness, anxiety, and tingling numbness for phosphorus. Another important medicine is uranium nitricum. Diabetes with emaciation. We can even think of iodine also. Excessive hunger, gastric irritation, polyuria, dry skin, burning in the stomach, nephritis tendency. Useful in advanced diabetes and degenerative changes. See, I've even used L serum in some cases with, for some cases. So wherever it is indicated, we can think of L serum also. Lycopodium, typical. Lycopodium is a most favorite of mine. Like my mother rightly said, like 10M potencies at regular intervals seems to be helping quite a lot. That's the tip I got from my mother. Diabetes with liver disorders. 90% of all of us have some or the other kind of fatty liver from grade 1 to onwards. Okay. So diet is a very, very integral part of this. Along with that, ensure that the person is doing enough exercises. Accumulation of fat, it will not just vanish into the thin air. They have to walk it out and sweat it out. Flatulence, red sand in the urine, intellectual kind but weak confidence, craving sweets, right-sided complaints, diabetes with gastric symptoms. Many people show this symptom. So diabetes with gastric symptoms is a must for lycopodium. Then you have natrum sulph. Diabetes in obese patients. Depression. Again, liver involvement. Worse, damp weather, bilious constitutions. Suicidal tendency is seen in natrum sulph, like aura metallica. Cephalandra indica, intense thirst, dryness of mouth, weakness, burning palms and soles. This even sulfur I used to cover with sometimes. Frequent use in Indian practice for elevated blood sugar and fatigue, given in mother tincture. Why I have written this is Kovaca. This maybe, it has high demand, like, high, this one for sugar. Okay. Gymnema. So glycosuria, increased sugar craving, polyphagia, traditionally believed to influence carbohydrate metabolism and reduces sugar craving. This I use as an intercurrent. Am I audible? Am I audible?
Yes, ma'am, you are audible and it was breaking.
Sir,
earlier,
am I
but
audible?
You are good.
Yes.
Because
Yes.
there is an unstable connection. Yeah, okay. Insulin is used to difficult diabetic controls, fluctuating fluctuating sugar. And if some person has, sudden up, down of sugar, you can, whenever it goes up suddenly, you can think of insulin as an intercurrent. So when it comes down, of course, you don't need insulin, but, as a homeopathic medication. But when it suddenly, there is lots of fluctuations, think of insulin as an intercurrent. There'll be lots of craving for carbohydrates. Weakness will be there. Then you have Helonius. Diabetes in exhausted women. Uterine weakness is there. So uterine complaints associated with diabetes, you can think of Helonius. Better by working, irritability, albuminuria. Arsenic album, again, restlessness is there. Burning pains are there. Diabetic gangrene, weakness, anxiety, thirst for small quantities. Midnight aggravation. Advanced diabetic complications. This is a very good medicine. R-Salp. Sulfur again, chronic diabetic with skin eruptions. Burning feet, itching, heat aggravation, untidy appearance, and early morning diarrhea. Calcarea cough, obesity, profuse sweat, crave sweets and eggs, easy fatigue, chilly patient, anxiety about health. See, I think just few more are there, sir. I'll just brush off because most of us know all these medicines. Tarantula, restlessness, nervous excitability, diabetic neuropathy. Again, whichever has lots of zinc, again, is very good for neuropathies. Tarantula is also very good medication for neuropathy, hyperactivity, twitching, burning pains, etc. Plumbum metallicum, I told you about constipation. Plumbum metallicum, you can think of diabetic neuritis, muscle wasting, again, thin person, paralytic weakness, retraction sensation, constipation, severe neuropathy. We have many patients who come and tell, I'm eating lots of fiber, but please ensure they are drinking enough water also. Because if you do not drink enough water, that fiber will be like one dry sponge inside your stomach. You will get severe constipation. So it is not enough that you, so I'm emphasizing again and again, because most of our patients, they will say, I'm eating enough fibers, doctor. But drinking the sufficient water for that amount of fiber is also important. Many cases we will see, in my practice at least I have seen, that many of the vegetarian people will have lots of flatulence issues, gas formation, all those. In those cases also, we should ask them to have enough amount of water. Now, complications are there for diabetes. In those cases, what can we use? Neuropathy, we can think of phosphorus, plumbum metallicum, R-sal, zinca metallicum also I have given in 1 or 2 cases. Diabetic foot, R-sal, Sicalicor, very wonderful medication. Diabetic skin eruptions, sulfur, graphitis, hepasulf, nephropathy, epis, terpentina, R-sal, SSL, L-serum also I have given. That's it, sir. The class is done.
Yes, Dr. Asha Varghese, it's really a very good session. Congratulations, because we know that diabetes is a vast subject, and we need a lot of dedication to treat diabetes. You cannot simply advise the patient to, because most of the patients used to take allopathic medicine, and when they found some difficulty, they used to come to us. And in those conditions, how one can manage diabetes with homeopathy? That is a challenging question. But
Yes.
otherwise, also we get patients when they found that, oh, doctor, last time when I checked this blood sugar, I found that it is 150 or 160. What to do? Whether shall I try start treating the case or not? What's your opinion on that?
So it's like typically if it is a, like I said, no, this diabetes is like, from the time sugar was found out, probably we have diabetes now. So it is typically a lifestyle disease. If it is, type 2, of course, a type 1, it will be because of so many other pathologies. We have to look at it. But type 2, we have good scope because we are not suppressing it here. We are not giving a medication, asking them to, not just be on the medicine. You can eat anything, you want. No. It is simple as we have to guide them as to what to eat and how to eat so that they can maintain it for a long time, because sometimes the medication itself might be harming other organs.
Yes, exactly.
So ours is like, of course, a very safe medication. But what we do is a holistic, healing. See, I keep telling, we homeopaths, we see an elephant as a whole elephant. We are not looking and examining one part of the elephant. So we are not specializing in one field. We are taking the whole, the human being as a whole, and we are looking at what caused this, which I feel is the right way to approach any disease. Because, if a person has a cough, if you go to a pulmonologist, probably it might be a, pulmonary cough. If you go to a cardiologist, it will be a cardiac cough. So for us, if, we have to look at all the rest of it and check like as to what it is.
Yes, exactly.
Yes, sir. So I feel that is like a wonderful thing for us. Like, I'm very glad we are into this system.
Yes, exactly. That's what we are doing here also.
Yes,
And
sir.
we need to make
Yes,
sure
sir.
that we get
Yes.
such an opportunity to treat patients with
Yes, sir.
diabetes.
I'm famous for running behind my patients with a stick in my hand practically because, the diet has to be monitored on a regular basis. The walking, the whole person has to change.
Yes,
His whole
exactly.
habits have to change.
Yes, since
So,
there is a
covered up everything. But the diabetic ketosis, I thought I'll cover it up later.
Okay.
I'll certainly do another session, but we'll look at some other topic.
Okay, I thought that
And thanks to you, sir, I'm sitting and revising all my
because
long learned.
because we need to take these cases seriously and present some cases because that will give a big boost to those who watch it for the first time. Oh, homeopathy has a solution for diabetes like
Yes,
that. They may
yes,
think.
yes.
Otherwise, all these things we people can get from Google or ChatGPT and everything. But a homeopathy cure cannot be they cannot get
Yes.
from anywhere else.
Yes.
That's what I have to add to this session. And
Yes, sir.
I'm waiting Benoit to say vote of thanks to the session.
Yes.
Sure. Doctor, it was an absolutely wonderful session. And
Thank
you
you, sir.
covered the gist of it.
Yeah.
And the lifestyle, that's what it is. And nowadays, as you rightly mentioned, every corner has a sweet shops, and everybody is serving this refined sugar and mostly the rava, those kind of refined uh, wheat.
Yes,
All
sir.
those and no fiber in the diet. That's
Yes,
basically
exactly.
causing explosion of diabetics all over India and across the world. One more cause is like this medicines, unnecessarily giving some of the medicines. For example, a pressure medicine, it just induces diabetes. The other way, if a person starts diabetic medication, it induces pressure. So it's like a circular firing squad, and we need to come out of it. Homeopathy rightly has its solution, and if a person is ready to follow the guidelines and the protocols on on their diet and follow the homeopathic medicines as a whole, consider a person as a whole, we can easily heal holistically every individual on this lifestyle issues. That's great. You presented it very well. Thank you very much. And thank you from
Thank you.
my ISPH
Thank you.
standpoint and every participant from my ISPH. And thank you very much. And I would request you to come back and more expanded version of this similar or diabetes, the lifestyle issues. And it will help all our doctors and practitioners and our patients and across Kerala or India. It will help our public actually.
Sir,
So
yes, sir.
please come back with an
Okay. Thank you,
enlightening
sir.
session.
Yeah.
Thank you very
And
much.
I want to personally thank Dr. Ram, sir, also. He has given me lots of hearts over there.
Thank you.
Yes.
I saw the
Yes.
hearts, sir. Thank you so much.
Thank
Okay,
you.
sir.
Very
Thank you
good
for the
session.
session.
Thank you
Yeah.
very much.
Thank you,
Yeah.
Binoy, and thank you, Dr.
Thank
Asha,
you,
for
sir.
this,
Yeah.
and also attend the session. Tomorrow we will have a session from Professor Dr. Balachandran, and Doctor will be talking about a comprehensive understanding of digitalis. With that, we come to the end of the day, 2082nd. Thank you all. Good night. It's over to Dr. P. Shaila to moderate the Malayalam session.